The number of ladies that are coming down with ectopic pregnancy is alarming these days. Almost on a daily basis, we are witnessing cases of ectopic pregnancy. One thing about this condition is that most people are ignorant of this very dangerous condition that they call ectopic pregnancy. It can cause a woman to die. Please, if you are seeing this video, do help me to share, because most people don't actually know about this condition. And some ladies have died because of this condition without people knowing that it's actually a ectopic pregnancy that have made them to die. That is why you have to share this video so that people will know how to detect this condition so early in life and prevent the complication that may result in the death of that woman. You have to understand first of all what is ectopic pregnancy. Please, if you are seeing our video for the very first time, do help us to give us a like and help us to share and also give us a follow in this very video. What is ectopic pregnancy? Normally, if a woman is pregnant, this is where the baby should be. This is called the uterine cavity of the woman. This is where the baby should be. But before the baby will come to this place, this is the ovary of the woman. This place is the ovary of the woman. This is where the egg is produced. So after the egg is produced, the egg will go into the fallopian tube, into the ampler part of the fallopian tube. That is where fertilization will occur, because sperm is going to come through this side and come here to fertilize the baby or the ova or the ovum, as case may be. After fertilization, this egg will now be transported back again into this place, that is into the uterine cavity. That is where the baby will now stay and grow. But what happens in ectopic pregnancy is that instead of this baby that is fertilized, or instead of this egg that is fertilized coming into the uterine cavity, it will move out of this place and remain in the pelvic, or even go into the abdominal cavity, or remain in this place, that is in the fallopian tube of the woman, instead of going into the womb. With time, because the baby is growing and because blood vessel is supplying that baby, at a point, because it's not growing inside where it's supposed to grow, that baby will now rupture, or the blood vessel that is supplying the baby will now rupture and start bleeding. The woman will now have what is called internal bleeding, internal hemorrhage. That can cause the woman to undergo a condition that is called shock, and that can result in the death of that woman because of excessive bleeding. Do you understand? Now, how do you prevent, or how do you detect this condition that is called ectopic pregnancy? How you detect is, number one is to have the index, or have the sense, because sometimes it can present in different ways, and sometimes some doctors may misdiagnose it for something else. Some may say it is caused by something is causing you to be having this. Meanwhile, it is ectopic pregnancy. We have seen series of cases like that. How do you know that you have ectopic pregnancy? One is to have the sense, or think about it first of all, because you may not think about it. Not thinking about it will cause you to die if you don't do what you're supposed to do. First of all, if you miss your period after having sexual exposure as a woman, that should tell you that you are likely pregnant. But the question now is, this pregnancy, is it inside my womb or outside my womb? How do you find out? What you do is that after you miss your period, within the 6 weeks, from the 6 weeks to 8 weeks of your pregnancy, you have to do what is called abdominal pelvic scan. That scan will show where the baby is after you have missed your period, or after you have become pregnant. So within this period, and it is actually within this period that rupture usually occurs. And why it usually occurs at this point is because at this point is when the heart of the baby will start beating very well, and at that point the blood vessels they have started developing very well. So the tendency of bleeding is higher at this very point in time. So that is why you have to do scan and detect it early, so that if you detect it, the necessary things will be done for you by your doctors. Now, what are the things that, if you have these things, then you should be thinking that you are likely going to have the pregnancy? Number one is that if you are taking fertility medicine for any reason, maybe you are taking fertility drug for IVF, and then you have gone to meet your husband, the tendency of you becoming pregnant is high. Or you're taking fertility medicine for any reason, maybe you want to become pregnant, or you want to donate egg. There are some ladies that used to donate egg. If at that point in time you meet a man, the tendency of becoming pregnant is high, and the tendency of one of the fertilized eggs being outside the womb is also higher. Therefore, if you have taken fertility medicine and you have met a man, please don't stay at home. If you miss your period, try and go for scan. Very important. Number two is that if you are the type as a woman that used to take postnatal all the time. Postnatal used to prevent this baby that is fertilized to move into the fallopian tube. It can also cause the fallopian tube, the cells in the fallopian tube, not to move the egg fast, so that the egg will not develop inside the womb. Because if egg does not develop inside the womb, the tendency of its dying up is higher. So as it's going to prevent this baby this egg that is fertilized going into the endometrial cavity or into the cavity, as it does that, it also has the tendency to cause the baby to cause you to have ectopic pregnancy. Another thing is if you have what is called recurrent PID, pelvic inflammatory disease. Some of these ladies used to have what is called, all the time you are having discharge, abnormal vaginal discharge. The tendency of you are having ectopic pregnancy is high, because that discharge may be as a result of infection, and the infection itself can cause this womb not to retain the baby. It can also cause this fallopian tube not to bring the baby into the womb, and that can cause you to have ectopic pregnancy. If you have had previous miscarriage as a lady, if you have done miscarriage, if you have done maybe unsafe abortion, or you have had miscarriage for any reason without being treated very well by a medical doctor, the tendency of you having this also is high. Please, if you are meeting this video for the very first time, do help me to share it so that people will understand this very condition that can cause a woman to die. Do give us a like and give us a follow as well. Thank you so much.